So let's start our session with a case scenario. Here comes a 54-year-old diabetic male presented to emergency department with fever, headache, vomiting and drowsiness for 2 days duration. On examination, he had neck rigidity but no focal deficits. Okay, he gave history of pain and discharge from right ear some time back, and CSF was turbid with very low glucose and high protein. So I hope you have understood the disease that this patient is suffering from. For the people who have not got the answer, let's analyze it. So he is a 50-year-old diabetic. Okay, so diabetic means altered immunity, or you can say decreased immunity. So he has a chance of infection. In addition to that, he had otitis media, or he had discharge and as well as pain and discharge from the right ear. That indicates he has otitis media. And following this otitis media, he develops fever, he develops drowsiness, headache as well as vomiting, and then he has drowsiness. Okay, so if you analyze, fever is because of infection or inflammation, and headache, vomiting as well as drowsiness are because of CNS manifestation, and this vomiting is because of increased intracranial pressure or increased ICT. So when we combine all these, the patient has some CNS manifestation or he has some problem with the brain. Now if you see, there is no focal deficit, that means no stroke. Okay, so the patient most likely has a CNS infection. Okay, and when you analyze the CSF was turbid. Okay, and then very low glucose, decreased glucose, and there is high protein. Okay, when you add this to the CNS infection, or you have a CNS infection as the baseline, and if you do add these infections, or if you add this CSF analysis to it, it shows that the patient has a CNS infection, and that is most commonly meningitis. Okay, and this meningitis, if you correlate with decreased glucose and increased protein, it is most likely a bacterial meningitis. Okay, that is how we analyze this case. So what is the most probable diagnosis? The patient is suffering from a CNS infection, and the infection is likely to be bacterial meningitis. Okay, so this is a bacterial meningitis, and we will see what are the causes of bacterial meningitis. Next comes, how are the etiological factors for such a case, or what are the etiological factors that we will see in our coming slides, which can be bacterial, it can be viral, it can be fungal, it can be mycobacterial, as well as it can be non-infective causes. Okay, so these are some of the etiological factors of meningitis. Then what are the expected microscopic findings? We will be discussing in our subsequent slides. So now coming to cerebrospinal fluid. So cerebrospinal fluid is secreted by choroid plexus, and it is a water clear fluid, crystal clear or water like fluid. Okay, here the total volume is around 90 to 150 ml in adults, and if you see the normal count, then in the WBC you have say less than 5 mononuclear cells. Now mononuclear cells means either lymphocyte or monocyte. Okay, so you can find lymphocyte and monocyte, but remember, no neutrophils. Okay, no neutrophils and no RBCs. So this is what we find, that less than 5 normal mononuclear cells in CSF WBC count. In children, you can find slightly higher count, but that cannot go beyond 10. Okay, so it can be 5 to 10, but normally it is less than 10 cells. Okay, so what is the indications of CSF examination? First, whenever a meningeal infection is suspected, CSF examination is a must. Okay, that is the most common indication of CSF examination. Second, if there is a arachnoid hemorrhage, or it is called as SAH. Third is primary or metastatic malignancy. Now primary means CNS tumor as well as CNS lymphoma. That is primary. And when we talk about secondary, now secondary can be epithelial. Okay, epithelial is metastatic carcinoma, and most common is breast and lung. Okay, so these are the secondary that metastasize to the brain, whereas when we talk about the hematolymphoid, then leukemia infiltration is more common. Okay, in the hematoloid, first is leukemia followed by lymphoma, and lymphoma can be again CNS primary, or lymphoma can be coming from a peripheral site. So that is another indication, that is primary or metastatic malignancy. Then sometimes we also evaluate the CSF in demyelinating disorders. Now what are the tests that are performed on a CSF sample? First, it is the cytology, and in cytology we do a cell count saying what is the total count, okay, as well as the differential count. So total count is the number of cells, and differential is how many neutrophils, lymphocyte, monocyte, eosinophils, so which cell is dominant and what is the total count. Then we look at the morphology. Now morphology of these cells can again be epithelial, most common it is hematolymphoid, or it could be epithelial. Now lymphoid again can be reactive because of meningitis, or can be because of lymphoma. Okay, epithelial we know that is metastatic carcinoma. So we first look at the count, and then we look at the morphology, whether they are reactive cells or they are neoplastic cells.